So you treat sleep apnea. That's all you do in your centers. Is that correct?
That's all we do. I background as a dentist, but I stopped doing dentistry about 8, 9 years ago to do treatment of snoring and sleep apnea 100% of the time.
Okay. So these people that have sleep apnea, they have two choices, I guess. A CPAP, right?
Yep.
Or three choices: do nothing, or get a custom-made appliance. And so what does yours do? It just opens the airway, just the jaw, just moves the jaw forward? How does it work?
Exactly. Basically, sleep apnea is about the tongue falling back, blocking the airway. It's kind of like a cork down in the throat, okay? And so no air is coming in or out. Basically, you have to get that cork out of there. Well, the cork's the tongue. So I had a clothespin or a fishing hook, grab the tongue, bring it forward. You're better. But I haven't had any volunteers. Even the kids with the tongue pin, the piercing, I figure I'll attach a clip, pull it forward. They don't like it either.
Okay.
So instead, we need something comfortable. Well, most people don't want to wear a CPAP. Even the doctors that come to me, they don't want to wear a CPAP. So the appliances that are out there, and there's more than 100 appliances out there, they all work by bringing the jaw forward. Now, by bringing the jaw forward, we're limited. We can only go so far. So what do you do when that's not successful? Because that's successful on about 50 to 75% of the patients. And on severe, it's even much less. So what do we do? Well, fortunately, my undergraduate degree was in biomedical engineering. Actually, out of Syracuse, I was like their first biomedical engineering class that graduated. And I said, this is mechanics 101. We need to go directly after the tongue. And if we go after the tongue in a way that doesn't gag you, we're going to win. So what I invented is an elastic that goes behind on top of the tongue to keep it from falling back. And so we go...
So it doesn't rest on the tongue. It's in the mouthpiece.
It's in the mouthpiece.
So when you're asleep, it just keeps what?
It keeps the tongue from falling back. So it's not going to be aggressive like pushing against it. It's just if the tongue misbehaves, goes to go back, it says, I'm here, don't do that. And so our appliance works both ways. It both brings the jaw forward like everybody else's, but then it's got the tongue strap as well. So basically, it's like a hybrid car. You got a gas engine, an electric engine, the best of both worlds. Well, this has both brings the tongue forward and the tongue strap. It's the best of both worlds. So you minimize any kind of TMJ or muscle kind of issues that you might have. Our success rates are just, and this is what my patents are on, because this is about success. This is about getting you better.
You have thousands of patients.
Absolutely.
I think you told me per month that you're helping.
Well, we've got 5 treatment centers. Yes, that's right, because we've got 5 treatment centers.
This is big. I mean, this is a big, it's like a movement.
This impacts millions of people. In fact, Randy, not only that, I can only help so many people. We have people coming in from all over the country. It's much more difficult. So I am training dentists all over the country at a very high level to be able to treat this the way we do.